Your Healthy Community is underwritten by the Quantum Foundation. The Quantum Foundation works in Palm Beach County to increase healthcare access, improve science and health education, and enhance the healthcare workforce. Over the past 15 years, the foundation has invested nearly $100 million with community partners who are helping us meet our vision of creating a place where everyone has the opportunity to live healthy lives regardless of their income, education, or background.
Good evening, I'm Toni May. Thank you for joining us here on Your Healthy Community. As you know, each week we talk about how to make your neighborhood, your community, a better, healthier place to live. Tonight our first segment focuses on addictions. Maybe you're thinking, oh, those younger kids, they have such drug problems. But there is a whole population that's often ignored when it comes to addictions and substance abuse, and that's the older population. We have plenty of older people here in Palm Beach County, and there's a place that they're getting help. Welcome my guest this evening. Welcome, Mr. Donald Walsh. Nice to see you.
Thank you very much. It's nice to see you and meet you. I am an alumnus of Hanley, having spent a year there starting with February 14th of last year.
Okay, and you were helped by the two people to your right, Dr. Barbra Kranz, the medical director at Hanley, right?
Yes, I am. Thank you, Toni.
And Juan Harris, who is over the older addictions program there.
Yep. Hello, Toni. It's nice to meet you.
So first, before we set up the help, let's set up the problem. Why did you end up at Hanley? What were you struggling with?
Okay, I had retired as a trial lawyer in New Haven at the age of 76, which is not very far away because I'm now only 78. And when I retired from working 12 to 14 hours a day as a trial lawyer, because my son took over my law practice, I found that I had nothing to really do. And I would used to go to lunch and drink wine at lunch and then go out for dinner and drink wine at dinner because I never did any household work or used an oven in my life. And I never realized I had a problem with alcohol because as a trial lawyer over almost 50 years of trying jury cases and working that long, alcohol was never a problem for me. But when I retired, drinking wine both at lunch and at dinner never occurred to me that it was too much until one day I went to Gulfstream Racetrack and I drank some wine with my lunch, which is normal, and then some people from New Haven wandered in and I bought them some wine. And I said to myself, if I have another wine and they're going to buy me wine, I'm sure. So I said, I'm going to leave while I feel I can still drive safely and get home to my place at Sea Ranch in Lauderdale by the Sea. So I got into my car and I drove home from the racetrack, parked my car in my allotted spot at the Sea Ranch condominium complex in Lauderdale by the Sea. And the next thing I know, I had collapsed on the ground of the garage between my car and my elevator. And hospital people came and all sorts of people came and they brought me to the hospital. And I found out that what had happened, low blood pressure fueled by alcohol abuse, caused me to have this problem. And I said to myself, having 3 children and 6 grandchildren, if this incident had occurred 5 or 10 minutes earlier when I was driving my car, not only would I have probably killed myself, I would have killed others. And what a legacy that would be to leave to my family, to my children and my grandchildren. And so my oldest son, who ironically enough had the same addiction years ago and had gone for reform at a place like Hanley, had engineered my getting to Hanley without my even stopping back at my condominium first from the hospital.
Good son.
And I found that Hanley taught me that alcoholism, okay, can be a disease that can afflict the elderly and there's a hereditary factor. And in my family, I discovered not only my son, but an uncle, a brother of my father, who came over from Ireland and wound up getting killed when he had an alcoholic problem and he was crossing the street and was hit by a car. So clearly it was in my family. And Hanley taught me that it was a disease and it does affect certain people and you can't go back. You've got to refrain from it. And I really learned at Hanley that it was an abuse. I never thought about alcohol because it never bothered me in my work.
Let me stop you right there because I think that that is the key. And you never thought about it. It was part of your lifestyle. And for your generation, I know my father's generation, that is just what it is. It's a lifestyle. You have a big job, you come home, you have a glass of wine or a martini. Barbara, how do you guys determine whether the problem described is an actual addiction in an older person? Because I think a lot of older people would take umbrage and say, I've had a couple glasses of wine every night. I'm not an alcoholic.
Well, Toni, I mean, Don's story is pretty typical of the patients that we see walk into Hanley, because what happens is that, you know, there are certain signs. The American Medical Association, first of all, talks about abuse as more than 2 drinks a day. We don't, as a society, we don't really think of that. But the issue is when an older person has other diseases associated with the alcohol abuse, that's when they get into trouble. And like with Don, even perhaps his physician may not have asked him how much he was drinking, because as the normal aging process occurs, physiologic, bodily changes occur, and you get more bang for your buck when you drink, with the normal processes that occur as we age. So we see all of that. We see people being bored, retiring from their job, having a lot more free time. And then we see them drinking the same amount perhaps that they were drinking, but they don't tolerate it as well because they're aging, and there is that shift that occurs in the body with aging.
So Juan, when you're putting together a program to help this population, what are some of the special needs of somebody that perhaps is over 60 and facing this struggle?
I think one of the first things that we want to do is educate the person that they're not a bad person. You talked about your father, and Don talked about himself, and as part of a cohort, when men are raised in WW2 area by fathers who were in WW2 or WW1, they have this feeling that they need to be strong. I can handle my own stuff. If I don't, I'm a weak man, and that sort of thing. So we need to educate them first that they do have an illness. In the same manner, if my doctor says, Juan, you have diabetes, well, he or she is going to sit me down, educate me on what diabetes is, tell me what my treatment options are, and that sort of thing. So that's what we do initially. Dr. Kranz talked about sensitivity increases as a person ages. And so while an older adult may come into treatment and they're being perfectly honest that they're still just having those 2 drinks a night, those 2 drinks, like Dr. Kranz says, is giving them more bang for their buck. And along with a lifestyle, sometimes losses. And losses are more than death as people age. And a typical case like Don's is that lack of purpose. So the treatment is, I can have 50 alcoholics, Toni, and all 50 of them will drink for different reasons. And the drinking, we know, is more of a symptom of the core issues that's for each patient. So we help identify what are the core issues. If we don't individualize a plan of care that addresses the core issues, then we're just treating the symptoms of the alcoholism. So
Don, once you went through the program, what was the main treatment, so to speak? Was it just finding other ways to fill that time? Because yours, and I am no expert, but just in your story that you told, sounds more like, I filled my time, this is what I did.
And that's true. And Hanley taught me that when I got out, what I had to do is focus on keeping myself busy, doing things. And what I wound up doing is I am now assisting various bar associations in Connecticut about maybe educating them with respect to the trial of jury lawsuits, including evidence analysis, telling people how to react at trials, how to handle any kind of situation that comes up that seems to be critical. And I found that by keeping my time involved in doing things that really not only are helpful to me, but very helpful to others, that you've accomplished both. And Hanley taught me that I've got to keep myself busy.
And are you doing pretty well at that?
Yes.
What about social situations? You're obviously a social person.
Yes.
You live in a social community. How does I know you guys teach coping mechanisms, but how does it, execute it in real life? Does it work?
Yes. What I wound up actually doing is I have replaced alcohol with Weight Watchers ice cream.
Well, that was a good plug for Weight Watchers. Thank goodness you didn't say like Bluebell or one of those fat-laden ones.
No, because I am concerned about my physical health. And I found that to refrain from alcohol, it was a test. It was an event that I had to conquer. And I knew that I had to have my willpower exercise this, because if you don't realize that alcohol is a disease that can be addictive to certain people, and I was one of those persons.
Obviously, you're going to share a success story like Don's, Barbara, but what does it take? I mean, in my years of doing stories on this, I'm always enamored with how one person can say, done, and other people will come back to you or other centers over and over again. I know it's a disease, but is self-responsibility really the key to success, no matter your age?
Well, I think at some point in time, Toni, there has to be some self-responsibility where you understand that you have a disease and it's not an option in your life. But what we try to do at Hanley is we work in a very integrated approach. So we'll look at the psychological issues, the emotional issues, the spiritual issues, the medical issues, and we'll help that person identify what we call triggers, so like an event or a situation or perhaps feelings that surround their use, and then what would they do when that occurs again, so that they're prepared to walk out of the protected environment and prepared to deal with life stresses.
And Juan, in a few minutes we have left, I really feel it's important because some of our audience may be concerned about themselves or their parent, their grandparent even. Are there certain signals other than collapsing in the garage, no offense, that you should look for?
Yes, absolutely. Some of the primary signals that we can look for is cognitions start to decline. They remember less things that they used to remember. And another sign would be subtle signs. Just generally in their homes, they'll form an area in their homes where they just may have a nightstand with the remote and their one drink a day, and sort of like build a nest in their home, and they sort of have this beautiful home, but they'll just spend certain times in that area. The instruments of daily living, paying bills or being able to go out and shop and just things like that will start to diminish. And then there's the activities of daily living, being able to, as it gets more advanced, be able to really feed themselves and bathe themselves and care for themselves, which indicates, which is more of a obvious signs of addiction. I think some of the barriers and challenges to family members and professionals in detecting this illness is that so many of the signs of this illness are mimicked by other illnesses.
Right, like a dementia. Because you're saying that, and I'm thinking, I might think that was dementia in my parent. The first signs of dementia, forgetfulness, kind of shelling yourself up in your home. So you really need a professional, I guess, to evaluate.
Clinically misattributed to other illnesses when really the primary illness is prescription drug use or alcohol use or some drug use.
I'm glad you brought that up because you obviously liked wine, but the Florida is the pill mill. I mean, we've heard it from the governor's office down to our local sheriff's office. They're closing them every day, especially here in Palm Beach County. how big of a struggle is that for our especially older population who's fighting aches and pains and diseases?
Toni, it's a serious struggle. I mean, in the past 10 years, even the patients that have come into Hanley, the older adult population, they're still coming in as alcohol usually as their initial drug, but the prescription drugs, which people think, especially in that population, are safe, have
a doctor gives it to you. Why wouldn't you think that?
Right,
Absolutely.
have increased fivefold
Oh
in
my
the past
goodness.
10 years. So prescription drug abuse is a serious problem, and you add alcohol to prescription drug abuse and you have a lethal combination.
I wish we had more time, so you're going to have to come back in the next
Okay.
season. But I really, really applaud you for this age to have the guts to say, I got to change this. God bless. So good for you. And I hope people watching will be inspired. We're going to put up some information so they can reach out to you all. Thank you so much.
Thank you, Toni.
Toni.
Thank you. Okay, here's that information we promised, and we'll be right back. Well, you heard our experts talk about how sometimes addictions can be masked by other things. One of them is depression and other mental illnesses. There's a big program being launched here in Palm Beach County to help doctors determine some of the mental illnesses that may be hidden and undetected. Joining me now is Pam Gionfriddo, the Executive Director of the Mental Health Association here in Palm Beach County. Welcome.
Hi, Toni.
And Dr. Paul Peluso, who's a mental health counselor, FAU, and helped put together a project we're going to talk about. Nice to see you.
Thank you.
Pam, first, let's just talk about the prevalence of some, what would be determined as mental illnesses, is much more vast than maybe most people watching would believe.
Right. The statistics say that 1 in 4 people in our community has a mental health disorder. That translates to roughly 300,000 people in this community alone. But we all know people in our family. We're all affected in one way or another by a family member or a loved one, a friend who has had a mental health concern. And it can be everything from serious mental illness like schizophrenia, bipolar disease, or major depression, all the way to feeling the negative effects of too much stress in our lives, or anxiety about the future that can also affect our health and well-being.
And with the current economic downturn, and certainly the last few years, Paul, what has that done to maybe either bring out or at least make people more aware of depression or some of these other symptoms?
Well, I think 2 things. Number one, obviously the downturn in the economy, people losing jobs, and even more importantly, people afraid of losing jobs and losing the ability to provide for themselves or for their families, increases the stress level and also increases the prevalence of a lot of mental health disorders, including anxiety and depression. As a result, a lot of these people are beginning to experience physical conditions that bring them into their primary care physician, but underlying them is usually some depression or anxiety that can be directly tied to the increased stress level in the overall environment.
So what happens is I go to my doctor, maybe my heart's been racing a little or I have bad headaches, but underneath it may be a depression or one of these other illnesses. And that's what the Be Merge campaign's all about, kind of getting these doctors to be able to determine the difference?
Well, a lot of doctors don't really feel comfortable diagnosing mental health disorders. They know that people are most likely to appear in their offices first rather than going to a mental health specialist. So 80% of the people who have a mental health concern are going to go to their regular GP first.
Wow.
So the doctors don't always feel comfortable recognizing it, and so the Be Merge initiative is trying to merge the ability of recognizing mental health concerns through very simple screening instruments, so doctors can ask a few questions, or the nurses, and being able to get more information that'll help them actually make a better, more accurate diagnosis about what's wrong. Now, part of the issue is that a lot of people appear in their doctor's office, like you said, their heart may be racing, they've got pain, their stomach's upset, they have all these physical ailments, but out of the top 10 physical ailments that they come with, only 15% actually have a physical cause.
Really, 15%?
That's right.
So do the doctors you're working with, and I know you're helping train them, are they open to doing another layer of, questioning? Because quite honestly, what I read is doctors are, because of, again, the healthcare situation, state of healthcare today, they're getting them in and out, and this is a whole nother layer of questions they have to ask, or is it something that's kind of not that difficult to include?
The reality is it's not that difficult, and even though physicians' time is very limited, the issue is that if a client comes in, if a patient comes in with an underlying mental health concern, the physician's going to wind up spending more time with them anyway. In one study, the average amount of time that a physician spent with a patient was 12 minutes if they didn't have a mental health disorder, but if there was a mental health problem included with it, that time got bumped up to 20 minutes. So the physicians are having to deal with this anyway, and we have included some screening tools that are very brief, that patients can fill out in the waiting room, and that can give the physician really good information very, very quickly to be able to screen for these particular disorders or conditions and then treat appropriately.
Now, I know the B-Merge initiative is being funded, but who is actually benefiting? I know some of the community health centers, but are there private physicians that are interested, or is it more of a public health setting?
Well, we are working in several clinics in Palm Beach County to help them learn how to integrate mental health and substance abuse screening into their care. And we're also providing technical assistance to these clinics about if they do find someone who really should be referred to a specialist, we help them connect the people to those specialists. But the doctors are very enthusiastic that we're working with, and we're finding that we've had over 100 doctors and nurse practitioners request to take the training, which indicates to me that they know that they're going to give better patient care, that the treatment outcomes are going to be better for the patients. And this is the way healthcare is going to be delivered in the future. So the ones that are really want to do the cutting edge healthcare evidence-based methodologies are on board for this training.
And do you see that, two questions. One is, I'm a doctor, I do this screening, and now I'm telling my patient, well, your stomach ache is really a sign of your depression or possible depression, and you need to go see this counselor. Are people hesitant to believe that? I mean, I know this is a new initiative, but this is, I guess my initial thing is, no, I have a stomach ache. I'm not depressed. Don't tell me I'm depressed, especially with an audience like we just saw in the segment before you, the older generation. That's kind of an insult almost.
Unfortunately, we are still dealing with the stigma of only crazy people go for psychological help, and that's really not the case anymore. It has become so much more less stigmatized than it was in past generations. One of the other things that we're seeing in medical practice is that we no longer see the difference between mind and body or psychology and physiology. We know that one affects the other and vice versa. So while, yes, your stomach ailment may be driven by some depression or some anxiety, it's also a stomach problem as well. And you have to manage it both ways in order to get a successful resolution. It's not just a matter of taking a pill and it goes away. It's a matter of taking a pill and then maybe managing your life in a different way. And that's where the mental health professionals can come in and be able to address that more efficiently than your general practitioner who has a very limited amount of time.
And I guess with the last few minutes, here's what I want to know. To me, it sounds kind of like lying a little bit of ego aside. I'll be honest. I'm a general practitioner. I think I know it all, but a mental health professional is coming in and saying, well, you kind of misdiagnosed here. Is that kind of one of the hurdles you got to get over to make this integration work for the future?
You know, the way I see it is we're changing the way people think about their health care, and it's not just the doctors and nurses that we're addressing. Patients also have to realize that there is a connection between the mind and the body. And for example, a friend of mine recently went to the doctor for a very serious stomach problem. And coincidentally, she had also just lost a dear relative who died shortly before, but she didn't mention that to the doctor. And really, a lot of the stomach problems were related to the grief and loss, but even her as a mental health professional, she didn't realize that she should share that information with her doctor, because if the doctor has the appropriate diagnosis, maybe she doesn't get diagnosed anti-nausea medication, maybe she gets a different anti-anxiety medication that would take care of the symptoms, because we now know what the real cause is for those symptoms.
And I think the bottom line, I'm sorry, we have about 30 seconds, is that that's it. It's getting to the diagnosis faster is what the mission sounds like.
And doctors want to do that because they can avoid misdiagnosis, malpractice, and do better treatment for their patients at the same time.
Okay, well, wish we had more time, as I always say, but thank you, and we're going to put some information on the screen about Mental Health Association so that you can get more information and find out more. Thank you both for joining me.
Thank you for having us.
Great program. Again, I'm going to say goodnight, but at the end you'll see the Mental Health Association number and website in case you want to log on and find out more. Thank you for joining us. We'll see you again next time right here on Your Healthy Community.
Your Healthy Community is underwritten by the Quantum Foundation. The Quantum Foundation works in Palm Beach County to increase healthcare access, improve science and health education, and enhance the healthcare workforce. Over the past 15 years, the foundation has invested nearly $100 million with community partners who are helping us meet our vision of creating a place where everyone has the opportunity to live healthy lives regardless of their income, education, or background.